Okay, so this is me in a hospital bed post-op after my knee surgery. But before we get there, we need to backtrack a bit to see how I even ended up in this situation in the first place. Badminton has always been a huge part of my life. I grew up playing it with my dad. It was our way of hanging out and honestly, how I made some of my closest friends growing up in Canada. And when I moved to Sydney, not knowing anybody, badminton became the way I built my community again. Fast forward to January this year, I was rehabbing my right knee and finally getting back into badminton, and that's when I injured my left knee. I saw a physio, got an MRI, and it showed a chondral flap in my trochlear groove. Basically, a small piece of cartilage peeling off the bone behind my kneecap. That being said though, clinically, my knee looked really good. I had full range of motion and my quads were strong, but I would consistently get a sharp mechanical pain every time I loaded my knee in a slightly bent position. And I did everything conservatively for 11 months. Your strength work, your load management, all the things I would prescribe to my own patients. But the pain never went away since it was a structural problem. And that affected my badminton as well as my work. So when I saw the surgeon, he gave me two options and painted the picture like this. What's going on inside my knee is the paint is peeling back slightly and exposing the wall. And so what they can do is option one, an arthroscopy, which is go in, clean out the flap, smooth out the rough edges, and I'd be back to work in a week. But the wall's exposed. Option two is arthroscopy plus AutoCart, which means that they still clean out the flap, but then they also attempt to regenerate the cartilage. The only catch though is 6 weeks locked in a knee extension brace. And to top it all off, I already had booked a trip back to Canada with my girlfriend. This would have been my first time home in 3 years, as well as my girlfriend's first time to meet all my close friends and family. But with Christmas coming up and work slowing down, it seemed like the one window where being locked in a brace for 6 weeks actually made sense. And so I had to make the decision to cancel my trip and choose the surgery that would give my knee the best long-term outcome. It sucked, but health is wealth, and there's always next year to go back home. And fast forward all the way to surgery day, a physio becoming a patient. Let's go.
Today is December 2nd, and it's time for surgery.
Kind of excited, kind of nervous, but I thought it'd be cool because it's not every day a physio goes for a surgery. I'm pretty happy that it's in the morning at 9. I don't know if it's a first surgery, but let's get it over and done with. I've never had a lower limb surgery, which will be interesting. I don't really know what to expect. The only reference I have is the patients I've seen who have done lower limb surgeries, so we'll see how we go.
And at this point, I already put my phone away, so I can only describe what happened. So first off, they shaved my leg and they put betadine on it to disinfect it, and then they pushed me into the operating room. They literally put the mask on me, and that was the last thing I remember. It literally felt like no time passed at all in between them putting the mask on and then me waking up. But apparently, it took an hour. They also took a few photos of the inside of my knee, which is interesting. I'm no doctor, but I'm assuming that this was the part that had the cartilage issue.
It's actually not that bad. It's like a dull throbbing. It's taking time.
Alright, so it's 5 o'clock and I just got home. I was in the hospital, did the op, stayed there for a couple hours, and then once I was discharged, my girlfriend drove me to the shopping center to just grab some groceries and food. I would say pain-wise, it's actually not too bad right now. It's sort of a 3-ish, touching 4 out of 10 pain. Dull throbbing like. I'm curious what the pain will be like once all the painkillers wear off. Because when I woke up today, it was around like a 5 or 6 out of 10. And after painkillers, it sort of dwindled down to a 2 or a 3 out of 10. And now it's just sort of coming back up a little bit. In terms of post-op precautions for me, it is first day non-weight bearing, so I'll be using the good old crutches. And after that, it's going to be touch weight bearing progressively as I can tolerate throughout the week to 50%, which is good because there was the potential for me to be 6 weeks completely non-weight bearing at all. And so I'll take weight bearing any day of the week.
O'clock in the night and I just woke up from a nap. I think the pain meds are starting to wear off and I'm starting to feel a bit more of a throbbing pain, which is expected, so I'll probably take a few more pain meds to help with that. Overall, I think the day went pretty well. The hospital process was pretty smooth. Only thing was it took a bit longer to get into the theater, but everything else went pretty smoothly apart from that. And my surgeon said that the surgery went well and there wasn't any complications at all. But now it's just facing the restriction of 6 weeks in a knee-locked extension brace. So fun. But I feel like it's a big relief just to get the surgery done, to be honest. I've been dealing with this issue for the past 11 months actually. So it's good to finally take one step forward in the right direction. Today is just a chill day, to be honest. Let the scar heal up and just take it easy. So over the next 6 weeks, I'll be documenting my life with the splint, as well as how I'm going to rehab my knee. So stay tuned for that, and it's late, so I'm going to catch some shut-eye, and I'll catch you guys later. Peace.